What's really important in male factor infertility is to really identify conditions that might be able to be corrected, and so that we can correct the underlying defect that might be causing the semen analysis to be abnormal. Now, in situations where we can't correct that underlying defect, we want to be able to identify those males where we can perhaps use intrauterine inseminations to correct the problem, or where in some cases even doing in vitro fertilization may be necessary. In those some situations, neither of those treatments may be possible, in which case we want to identify those people in whom options of either donor sperm or adoption may be a possibility. We also want to be able to identify in severe cases of low sperm counts where there might be a genetic condition that could be causing this problem. And so we want to identify genetic disorders that could be possibly passed down to the offspring, and that might cause similar types of problems as well. Now, what would be important to the male partner in terms of their general health would be to identify those medical conditions that could be causing not only abnormalities in the semen analysis, but also could pose serious health problems. So doing a physical exam and evaluation is also important. In addition to obtaining an adequate history, it's important to do a physical exam. The physical exam is generally done by a urologist who can check for abnormalities in the reproductive tract. So typically, if there is a significant male factor or a problem, we oftentimes will have a urologist involved to do an evaluation and possibly correct any underlying condition that might exist.